Hello, shalom, and welcome to our class. It is a good moment to be informed for everyone, minister, for everyone, pastor, bishop, everyone that handles the word of God, everyone that God has put in charge of God's people is required to be equipped all round about. We are living in a society that is changing day by day. We are living in a society that is highly dynamic. Generations are changing faster than we have ever witnessed. Technology is changing dynamically in ways unprecedented. And it is important that the man of God be equipped all round to deal with the needs of his people, of his community, and his family. In this module, we're dealing with substance use, abuse, and dependence. And we shall be looking at the definition and causes of substance disorders. I know that for some of us, we have already gone through this in another class, but receive this as a fresh release of this format of a message that is in form of an audio. I know you have your notes, but this one can also be of help, especially when you want to learn or to study when books or other materials are not handy. You can use this to listen into the content and be able to familiarize with what we are learning. Allow me to read the word of scripture before we get into this. The Bible says, therefore, my people have gone into captivity because they have no knowledge. Their honorable men are famished, and their multitude dried up with thirst. That is in the book of Isaiah chapter 5 and verse 13. And if you look at verse 14, the Bible continues to tell us what happens when knowledge is not, in place in our lives, in our ministries, in our families. The Bible says in verse 14 of the same chapter 5 that therefore Sheol or hell has enlarged itself and opened its mouth beyond measure. Their glory and their multitude and their pomp, and he who is jubilant shall descend into it, just because of the lack of knowledge. My people have gone into captivity because they have no knowledge. They lack in this one much available but little adopted aspect of life, knowledge. God has created us and has given us a very unique part of us called the head. The head. Anybody that wants to head must have a proper head. Anybody that wants to head, lead, must have a proper head. Many of the problems that we are encountering today are problems that can easily be dealt with if only we imbibed into knowledge that particularly suits into those areas that are troubling us. One of those areas is the menace that is arousing families, schools, universities, and our society at large. And that is what we're calling drug and substance abuse. For that matter, we're going to delve into this topic more deeply by looking firstly at lesson 1 that has to do with substance use, abuse, and dependence. And to begin with, we're going to look at the definition and causes of substance disorders. Substance disorders. Now, what is substance abuse? Substance abuse is any misuse or overuse of substances such as prescription drugs or alcohol, or the use of illegal drugs. In simple terms, this means anytime that a drug is not used the way it was intended to be used, then we're talking about substance or drug abuse. The most common method of substance abuse is the overuse of a substance. When you're talking about a substance, you're talking about a drug, such as drinking alcohol excessively to the point of being drunk, or overusing tobacco to an extent that you cannot survive without it. Drug abuse is another form of substance abuse. Drug abuse is when over-the-counter or prescription medications are taken more frequently than they need to be taken, or when they are taken when they do not need to be taken at all. This happens most often with narcotics or psychoactive medications, which are medications that change the balance of hormones in the brain. And we find that when this happens, we find that we end up with a situation that alters the personality of the person. So that once they have taken in such medications or drugs, they are no longer their normal selves. It alters their way of behavior. It alters their character. Substance abuse also includes the use of medications or alcohol for uses other than what they were intended to be used for. It is interesting to note that most of the drugs that are abused have their legal use, have their normal use. These drugs, they were manufactured or they are created. God created either the drugs or the raw material from which these drugs are drawn for a particular useful human use or profitable human use. But human beings, in their own way, discovered that they could use these drugs for other uses, for self-satisfaction. Sometimes to deal with thoughts or a past that is painful to them, to deal with emotional pain or even physical pain that they cannot put up with, and they have to take drugs as a way of reducing their pain or putting away the pain temporarily. Now, I would want us to look at substance abuse versus or what we call substance use, meaning of substance abuse versus substance abuse. Use versus abuse. What is the meaning of substance use and what is the meaning of substance abuse? There are times when narcotic medications, over-the-counter drugs, or psychoactive medications are necessary in order to treat pain, body conditions, or a mental condition in the body. There is nothing wrong with taking medications for those reasons. However, there's a point when substance use can turn into substance abuse. Here are some of the differences between substance use and substance abuse. And we shall be looking at the characteristic, and then we shall compare it with substance use and substance abuse. For instance, we have a characteristic here, how the substance is taken. In substance use, substances are taken as prescribed or directed. How the substance is taken. Then in substance use, substances are taken as prescribed or directed. Then you have substance abuse. You find that here the substances are taken without being needed, or when they are taken in excess of what is prescribed or directed. Remember, you're comparing abuse and use, or use and abuse. Then another characteristic of drug use or abuse is duration of taking the substance. In substance use, use of the substance is stopped once the substance is no longer needed in the body. But in substance abuse, the use of the substance continues beyond when the substance is needed and often can become difficult to stop. Characteristic number 3 is person who initiated use. Who initiated use? The person who initiated use, that's a characteristic. And then we find that in substance use is usually under the direction of a doctor or a medic. The use of a drug is usually initiated or directed by a medical doctor, a medic, a nurse, or a trained personnel. But in substance abuse, the use of a substance is usually initiated or directed by a person who starts on their own. The person starts the use on their own or with the help of peers, friends, or people, other users who introduce him or her to the drug. Another characteristic that I would want us to put into consideration is tolerance. Tolerance, that is increase in the amount needed to get the same effect. Tolerance. An example of tolerance is when someone starts, for example, when someone starts taking alcohol, they may start with a glass of spirit, or maybe a bottle of beer or a cup of beer, and over time they realize that the cup is not enough to give them the effect they want to feel. So they graduate to 2 cups, they graduate to a gallon, they graduate to 2 gallons, and that is how we can define, we can illustrate tolerance. It is the increase in the amount needed to get the same effect. So that you find someone who started by smoking a quarter roll of bangi, after 2 years, they have graduated. They will need to take 2 rolls maybe at a go to be able to feel the same effect they felt when they took the quarter roll. Someone starts by smoking, just taking a puff of cigarette, and they feel an high. They feel okay. But over time, they end up with a packet of cigarettes. What does that mean? Their body needs more of the substance if they have to feel the same relaxed effect they felt when they took the first puff. That is known as tolerance. It is known as tolerance. Now, in substance use, tolerance does not occur. For example, when you are taking malaria queen, I don't know which drug we can use as an example, but I would say when you're taking a malaria tablet or a dose of malaria, and you are done with the drugs, or you are cured, the body does not ask for more drugs. The body does not ask for more drugs. But when it comes to substance abuse, once one starts using the drug and continues using it, tolerance does occur. Tolerance in substance abuse, tolerance does occur. There's no one to measure to you what amount of marijuana you'll take, because it is not timed. It is something you have prescribed, ascribed to, and would wish to continue with, if there is no intervention that is undertaken, or even if the person himself or herself does not get help to stop the abuse of the drug. Now, I would want us to define another term here, that is substance use disorder. Substance use disorder. Substance use disorder is a disease where a person's brain and body change due to the use of a substance to the point that they are no longer able to function without or control their use of a specific substance. You're saying substance use disorder is a disease. And this disease is characterized by this, that a person's brain and body change due to the use of a substance to the point that they are no longer able to function without the drug, or control. They are not able to control their use of a specific substance. We say they have substance use disorder. They are helpless in terms of controlling the use of that substance. Now, a person with substance use disorder uses a substance so much that their body becomes dependent on it and they are unable to stop its use on their own. Now, this substance use disorder is often referred to as addiction. You find that there are many different substances that can be a part of substance use disorder. There are many different substances that can be a part of substance use disorder. We shall be looking at that shortly, but I want you to understand that substance use disorder or addiction is a disease. So sometimes when you hear people, when you hear us or parents, those people who care, telling an addict, stop taking beer, stop taking bangi, I would equate that to you telling a man that is suffering from malaria, stop having malaria. I would equate that to you going to somebody who has an infection of HIV/AIDS and you're telling them, stop having HIV/AIDS. Somebody who has hepatitis B or somebody who has cancer and you tell them, stop having cancer. Stop getting sick from this disease. That means that if substance use disorder is a disease, then there must be a cure. We must go for the cure. We must look for the healing and the healing process, the cure that brings wholeness to the sick person, this person that is sick of this disease called addiction or that is called substance use disorder. And that is why we are in class. That is why we need to learn. We need to study so as to understand as pastors. I know we pray for the addicts. I know we intercede for them. I know we take them aside for counseling, for biblical Christian counseling. But we need to know, apart from these spiritual interventions, what else do we need to do with the addicts, with the sick, the people who are sick of substance use disorder? What else do we need to do? We need skills, and that's why we are in this class. We need skills to learn how to deal with those people who are sick of this addiction disease. Now, there are some substances, the common substances that normally take people into addiction or that get people addicted. These are some of the common substances that people get addicted to. In our world today, there's so many other drug formats or drug abuse formats that we shall also discover and discuss in class. Now, some of the substances are alcohol, very common, cigarettes, very common and affordable, prescription medications. There's certain drugs that are sold over the counter in chemists, or they can be prescribed by a doctor, but many times they end up being abused or being used abnormally by the person who has received the drugs, or sometimes such drugs by various ways fall into the hands of addicts, because they are the addicts who have known that when I take this drug, it gets me high. So they can use any means. They can go through some maybe corrupt medics, workers in the hospital or in chemists, or they can just go and buy with fake prescriptions from a doctor, and they obtain the drugs and use them. Then we have got illegal drugs. We have got inhalants, and we have got what we call solvents. Now, we shall be looking at all those in detail later, but that is just for an example of some of the substances that are easily abused or that easily get people hooked to or caught up in this addiction disease, the substance use disorder. Anything that can give the euphoric feeling of being high can be the substance used in substance use disorder. anything that can be used. You've seen some people sniffing tobacco excessively. Very young people. There's a long time ago, we knew that tobacco was only sniffed by those people, or by the old people. But we've seen instances when the young people are using tobacco, they sniff it, they chew it, because it is giving them a high. We've seen some people even chewing tea leaves or smoking tea leaves because it gives them a high. So we are saying that any of these substances that can give one a feeling of euphoria, a high, you feel high, and with lesser amounts than other substances, will always be preferred by the addicts. Many times, as addiction catches on or gets hold of its captive, um, the addict now becomes prone to use of anything that will give them an high, or a high, a feeling of an high, or a euphoric, what we call a euphoric feeling. We can see that some substances, as I started saying, give the feeling of euphoria with lesser amounts than other substances, but all of them will eventually give the feeling of enough, if enough of the substance is taken. They will eventually give the feeling of euphoria if enough is taken. Maybe someone who is smoking bangi will have a high before before someone uh, who is chewing miraa gets a high. But at the end of the day, they may end up at one junction, or they may end up at one road end. Someone who is injecting themselves will feel high faster than someone who is maybe smoking the same drug, but at the end of the day, they land at the same finishing line. A person with substance use disorder will continue to take the substance even after it starts causing problems with their health and in their lives. That is how cruel drug abuse is. That if a drug is causing harm to someone, if a doctor announces to you that announces to someone, to an addict, that you are having a lung problem because of smoking cigarettes or smoking marijuana, or because of some inhalants that you are using as an addict, that addict will not stop smoking simply because it is causing them trouble. It's a disease. It has taken them captive. They will continue using the drug regardless of the harm it is causing them. That's how serious, that's how cruel drug addiction is. What are the causes of substance abuse? What causes substance abuse? What causes substance abuse? Now, I'll read through the causes of substance abuse, and then I would want us to discuss them in groups. You take up the points, and then you discuss them in groups. Now, we cannot say that there's any current known cause of substance abuse. However, there are certain identified factors that are believed to contribute to the development of substance abuse in a person. And also we can say there are some people that will have all the factors and never abuse a substance. Some of these factors can lead to the development of a substance abuse. The following factors can lead to the development of substance abuse. These factors that cause substance abuse or can cause the development of substance abuse are genetic vulnerability. Genetic vulnerability. Some scientists believe that there are certain genes that make a person more predisposed to developing substance abuse. They believe this because it seems that addiction runs in some families more than others, or more than in other categories or groupings of people. That addiction can be more identified with certain lineages or families than in any other institutions of the society. people are more likely to develop substance abuse or substance use disorder if someone else in their family, especially the immediate family, is an addict or substance abuser. It is common to trace substance abuse or initiation or introduction to substance abuse to immediate family members. And that's why we can say that at times we find a connection between family relationship and the substance use disorder. Certain genes or clusters of genes have been identified as being linked to addiction and the substance use. There were similarities in the genes that were expressed among people that have an addiction and a substance abuse. I would want the class to get into discussion on this. We shall be following up with a discussion and try to identify certain families and the studies that really show and prove that this genetic vulnerability is truly a fact or is a truth when it comes to substance use disorder. You can approve it, you can disapprove it. Then number 2 cause of substance abuse, we have said number 1 is genetic vulnerability. Number 2 is environmental stressors. Environmental stressors. There are factors in the environment such as jobs and school that can lead to substance abuse. People with generally unhealthy lifestyles tend to be more prone to substance abuse. That is because their bodies are not as healthy. Allow me to say that in a better way. That is because their bodies are not in as healthy of a state, and their minds are not as well able to handle problems as they come up. So they turn to substance abuse to try to escape the problem. So the drug is used as an escape route. It's an escape path. It's an escape road from the problem into some bliss, into some peace, a moment of euphoria. If it's hours or a day, you just run away from the problem because the drug gives you that euphoric feeling. There is also the possibility of using an illegal drug for the first time, and it causes changes in the body that then make the body crave the drug more, leading to a substance abuse or leading to substance abuse. We're saying that there is also a possibility of using an illegal drug for the first time. It is not that those people who are drug addicts today, they didn't start having a timeline that I will take it for 10 years, that I will take it for 20 years. No, they just began. Maybe somebody found an illegal drug as an escape and they wanted to take it one day, and one day they felt good. The second day they felt good. At one point they felt like, I don't need to continue with this thing. It's bad. But still, the body now starts craving. The body starts craving for the substance, and this eventually leads to taking more drugs or more of the drug. It leads to consuming more of the drug, and subsequently to substance abuse. Number 3 cause of drug and substance abuse is social pressures or sociocultural factors. Social pressures or sociocultural pressures. This is very common. This is very common in our generation today, in our time today. It is very common that the living conditions, are becoming tougher by the day. There are individuals that choose to associate with others that abuse substances. Being around such people who have problems with substance abuse and people maybe who tend to deal with drugs, not only using but also maybe dealing with drugs, not only using drugs but maybe dealing with the drugs. You understand that? That maybe someone is not, or a group of people, maybe a family is not even using drugs. Maybe a group is not using drugs, but they are peddling the drugs, they are selling the drugs, they are dealing with the drugs. which may be a bit uncommon to find someone dealing with drugs and not consuming them. But under any circumstances, you find the pressure of such a group on that individual that gets close to people who are using or dealing with the drugs, we find that that person is more prone to use or to abuse drugs or to abuse substances more than someone who is not close to such a group. So being around other people that have problems with substance abuse tends to increase the chances of having substances abuse. The closer one is to people who abuse substance, who are into substance abuse, the higher the chances of abusing the substances. Even if a person wants to resist the use of substances, peer pressure that is put on the person to use the substances eventually forces the person to fit in. They want to fit into that peer group. They pressurize him, and because he wants to fit in, he also becomes a substance abuser. Eventually, this use of substances, when in the company or because of peer pressure from those people who are abusing the substance, eventually leads to use or substance use. It is this substance use that subsequently leads to abuse, and to substance abuse, and then to substance disorder. I believe you're on the same note, we're on the same page, and in case you don't understand anything, please mark it out and ask a question. Individual personality characteristics is another cause of drug and substance abuse. One of the causes of substance abuse is individual personality characteristics. Some people are better adapted to life and the many changes that life can bring. You find that we are not the same. In the hard knocks that life sometimes offers us, all of us, we don't have the same capacity to bear the hardships of this life. So those individuals that are not as well adapted to the issues or the challenges of life will eventually turn to a vice of some sort to deal with their life. They will abuse substances to not feel the feelings or the pain, the discomfort that are associated with living this kind of life. In terms of sadness, stress, or anger, some people may resort to substance abuse to avoid those feelings. Just want to feel comfortable, away from sadness, away from stress, away from anger. So they resort to substance abuse to avoid those painful or uncomfortable feelings. The person that abuses substances may also do so because they think that not using those substances excessively leads to a boring or dull life. Sometimes myths are created around a particular lifestyle. Where you find there are people who think that if you don't take beer in the evening on Friday or maybe every day, then your life is boring. There are people who literally believe that if you don't take to some kind of drug, then life is boring for you. And I believe there are people who come from such environments, from such communities or families. You can attest to the fact that in many families, alcoholism and other forms of abuse of substance abuse is not just an entertainment. It's a way of doing life from morning to evening, sometimes over the weekends. For many people working, weekend, Friday is a day of showing that life is going. For you, life is doing. You're good to you're living to the dream of a man in the city, a man in your town, the employed class in your city, the employed class in your village. You've got to take beer on weekends. And if you don't do so, when you're in that cohort, when you're in that territory, when you're in that community, then for you, according to them, life is boring. And they preach to you a message to show you that you are not doing life. Some will tell you, you are mean, that's why you don't want to come and share in this kind of fun, the weekend fun, the evening fun. They want to show you that there can't be fun without drugs. There can't be fun without alcohol, which is a lie. And it's a lie that has been peddled for so long that it has literally become a truth in some families. I know I come from a family where for a long time I believed that as a man you must take beer. To show that you're a man, you must take beer. I knew that the only way to be happy and to show life that you're doing life is to be with your court out there, taking beer, smoking, doing things that other men are doing. And if you don't do so, then you're considered a woman. And the way I come from, no man wants to be called a woman. That's how serious some of these myths are. Some of the things that are driving our young men and the young girls into addiction. You've heard of a common myth that about bangi, marijuana, that weed is medicine. But you ask them, this weed that is medicine, who is the doctor that examines you and gives you the dosage? And for how long will you take weed? You've heard of a myth. Some girls told me the other day that if you take weed, you cannot get any cancer attack. Which is this doctor that give you the dosage? And because a dosage is measured in terms of time and quantity, how much you should take and for how long, what dosage did the doctor give you? Now, well said of that, enough said of that. I think we should move on to diagnosis of substance abuse. How do we diagnose substance abuse? How do we diagnose substance abuse? Commonly, any parent, any teacher would tell a student is drunk because they are staggering, because they are smelling alcohol, because they are smelling tobacco or some cigarette smoke, But what about substances that have no order? What about substances that just give someone a euphoria and not literally a staggering effect? We want to look at some of the ways in which we can diagnose substance abuse. Diagnosing substance abuse is based on several observations that are made. The first indication of a substance abuse problem may be to a person's family and friends. These are the first people may observe or notice that this person is under some influence. They are taking something that is not served on our common tables during meals. They may notice things such as less participation in activities such as work, school, or hobbies, lack of proper body hygiene, red eyes, and slurred speech. There may also be changes in mood and interactions with family and friends. Now, that is in a layman's language, or that is the layman's skill, ability, capacity in identifying the common features of someone who is into substance abuse. And we have said that someone who is into substance abuse may exhibit less participation in activities, group work. When they're given their own individual assignments, they are not able to finish. Or sometimes when they are given group work, they want to do the work on their own. They don't want to work with other siblings or students in the school. Some of them start having a negative attitude towards schooling and teachers or the school environment. Some of them they have no taste anymore for hobbies. What used to be their most their most adored hobbies are no longer, it is no longer the case. There's lack of proper body hygiene. You start finding that even a young person has no urge, has no self-drive to even bathe or to clean his clothes, to wash their clothes. Other features that can be noticed in a person that is getting into drug or that is into substance abuse, maybe bloodshot eyes, a slurred speech, sometimes elated mood, sometimes down moods, and also there may be changes in interactions with the family and the friends. Now, other than the family and friends that surround the person, doctors may diagnose the drug and substance abuse upon examination. If a person, for instance, abuses substances for a longer period of time, then there will be physical changes that will begin to occur. With both alcohol and drug abuse, there are often changes in the liver. The liver tends to become enlarged and secrete extra enzymes in the bloodstream. Laboratory tests and imaging can help to diagnose the changes in the liver and give the doctor a good idea that substance abuse may be happening. The pancreas will also change with alcohol abuse. The pancreas can become inflamed and increase the release of its enzymes, creating a life-threatening condition. This is often a sign to doctors of um, substance abuse. Now, notice that also there are tests that are done. Doctors undertake these tests or examinations on the urine, on the saliva, to test for drug and substance abuse. Blood test, urine test, and saliva test. All this can be done to examine uh, uh, substance abuse. There are also signs that can readily be observed, like we said before: eye redness. Other signs include staggering, dizziness, falling, lack of coordination, unusual activities, weight loss, constant fatigue, memory problems. And these ones, all these, like when you talk of memory problems, you may realize these can be a reason why maybe a student is not performing in class. Maybe they are not performing in class, not because they take marijuana, but because marijuana affects the functioning of the memory, the effectiveness of the memory, a part of the brain. And so it ends up in poor performance in class. Maybe issues of violence and aggression. There are people, when they take drugs, they become aggressive, they become violent. When these indicators are observed together, the diagnosis can be made of substance abuse. These factors each can stand on its own, or a combination of these can tell us whether someone is into drug and substance abuse. Treatment of 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 substance abuse. Now, I would want us to look at a few statements here on the treatment of substance and drug abuse. I know this is this is normally the work of experts, but also as a helper, as a Christian counselor, or as a pastor, you need to know how to get help for the people maybe that you're dealing with. There's some people that there's what we normally call the medically assisted therapy for drug and substance abusers. It's important to know what kind of help, what kind of medical help or therapeutic help can you get for them. If you can counsel them, can you also get them some other forms of treatment that will enhance what you're already doing for them. The treatment of substance abuse often starts with addressing the immediate need to get off of the substance. It is important to safely detoxify the person. Detoxifying or detoxification refers to the process of removing the toxin, the poison of that substance from the body. There are special detoxification centers and specialized hospitals that do this on a regular basis. The person's vital signs will be continuously monitored during this time, as a person can die during detoxification. I know there are people who take detoxification very lightly, and they just want to administer the drugs that they know, the drugs they can buy, but we should know that it can be very, very fatal for anybody to try to do this without medical guidance, without the help of a medical practitioner. They may be given, the person who is undergoing detoxification may be given a certain medication to help minimize the side effects and chances of death as a part of treatment. You know, the detoxifiers also go hand in hand with other drugs that maybe reduce the side effects of the same drug that is being administered. As you're trying to get the person off the drug, the person may undergo a certain withdrawal symptoms, some of which are very risky to the health and to the life of the person. So it is important that a medical practitioner or a medic be on the ground or be within reach to be able to help in treating even the side effects or in administering the drugs that are supposed to minimize the side effects and the chances of death or other attacks, health attacks. Eating balanced meals and staying hydrated throughout the day are also part of the detoxification treatment. That we ensure that a person eats a balanced meal, and that balanced meal, you need a nutritionist or maybe a doctor that is undertaking the detoxification process, or that is taking the patient through the detoxification process, is able to analyze and is able to like prescribe what kinds of food that person needs to eat. If you go to the people that have been to rehab, or to the people that have undergone this detoxification, some of them run away from the detoxification centers because they maybe somewhere they were treated, in some places were not treated professionally, and the detoxification backfired on them. Maybe they had no choice of what to eat in those centers. They just ate what is available, and some of the meals that were offered could not cope with the adverse effects or the side effects of the detoxification process, as it were. Now, in that regard, we have said eating a balanced meals and staying hydrated, that is taking a lot of fluids throughout the day, is part of the detoxification treatment. When there is long-term substance abuse, a person may need to go from a detoxification facility to rehabilitation facility, where they will do the following treatments. That is, once if someone is a long-time abuser, a substance abuser, then they may need to be taken from a detoxification facility to a rehabilitation facility. And in that rehabilitation facility, there are other treatments that are carried out, so that once the detox is safely completed, then treatment progresses to determine the underlying cause. Once examinations, that is, then further diagnosis is administered to determine the underlying causes of the condition, the addiction condition, the disorder that person is going through, because the addiction or substance disorder may manifest in various ways. So that sometimes you find there are people who have abused substances, or they have abused drugs for a long time. They also have conditions like epilepsy, some have other chest conditions, some have blood conditions, some have mental conditions. It is important to take them through a medical examination, so as to determine the eventual treatment procedures. A treatment procedure can only be preferred after proper examination. After or sometimes during detoxification, the person may begin speaking to a therapist to start psychotherapy. You're still in the treatment, psychotherapy. The purpose of this is to help determine if there are environmental, social, or even economic causes for the substance abuse. so that you find a family history will also be discussed to help determine if there may be a genetic disposition causing the substance abuse. And also this helps us to determine whether the family has enough capacity, social capacity, to handle the person in rehabilitating them, or in helping them after the rehabilitation or during the rehabilitation process. Or is the family also one of the causal factors in the addiction or in the disorder status? From there, as we are about to finish this, after determining the cause, then other treatments will start. Remember, we are doing this with the help of a medic. Don't go doing this on your own. It can be very tricky. It can really backfire on the person you're trying to treat. The treatments will differ based on the substance that was abused. If heroin or other opioids were abused, then treatment will include going on a methadone or methadone treatment. If heroin or other opioids were abused, then treatment may include going on a methadone treatment plan. Methadone is a medication that blocks opioid cravings. We shall be looking at those types of drugs. Shall be looking at them maybe in the third part of this series, or the second. Methadone, I've said methadone is a medication that blocks opioid cravings and also blocks the effects of opioids. If alcohol is abused, then treatment may include taking lorazepam. Lorazepam is a medication that works to decrease anxiety. The effects that it has on the central nervous system help to make the effect of we are talking about the effect of lorazepam. Lorazepam is we have said it is normally used in treating what alcoholism, and what it does is that it works to decrease. It's a medication that works to decrease anxiety. The effects that it has on the central nervous system help to make the brain function optimally and the body feel normal. This helps to regulate body functions that can become erratic during alcohol withdrawal. During alcohol withdrawal, there are certain symptoms or there are certain behaviors that the addict may exhibit, that would require regulation. And lorazepam is one of the drugs that is the drug that can be used to regulate the body function, or the function of the brain, so that the body can feel normal. Beyond the medications and psychotherapy, there may also be behavioral therapy. Beyond the medications and the psychotherapy, there may also be behavioral therapy. What is behavioral therapy? This is a therapy that teaches the tools and resources that can be used to reduce stress, anxiety, and worry, to help a person become better at adapting to life on life's terms. Behavioral therapy will also teach healthy habits that help the body function better, such as exercising, eating a balanced diet, breathing techniques, and non-harmful ways of expressing negative feelings. Long-term management plans are often made for a person with substance abuse in order to help that person stay on track and not relapse. The long-term management plan will also often include continued therapy and joining a support group such as Alcoholics Anonymous or Narcotics Anonymous. In the long term, close attention is usually paid to the person's health, since there can be lasting effects from long-term substance abuse. Treatments for organs that may have been damaged become a part of the long-term management plan as well. As we learn this, we need to get to understand very clearly that substance and drug abuse is not a disease that stands alone. It comes with other complications on the body. It comes with the complications that can affect it. The drug and substance disorder can affect the vital organs. It can affect eyesight. It can affect hearing. It can affect the brain, the central nervous system in very, very severe ways. That means as we are trying, when we try to help uh, those people who are hooked to drugs or to alcohol, we should understand that they have issues that demand more medical or professional attention than we may think. When you see a young man that has swollen cheeks and reddish lips, eyes that are protruding, you know that you are not only dealing with an addict, with a person who has the addiction disease, you're dealing with a person who also has a disease of the vital organs. And that is why it is very hard sometimes to get them back, because the very functioning of those organs that are affected is really reliant now on the amount of the substance being supplied to the body to keep the body running as if it were normal. So they need medical help, sometimes from specialists in those particular areas. Is it the liver? Is it the heart? Is it the brain? They may need to go to that extra, to that extent of getting a specialist to handle their case, because it's not just now about drug addiction. There are other conditions in the body that must be addressed. Sometimes you find an addict who cannot control their urine, the way they pass out urine. They will need help from the medics on how to deal with that. Some of them, it's passing through, they can't even tell when the stool came out, because they have just the drug has had such a devastating effect on their body systems that they are sick far beyond their mind and far beyond the disorder that you're trying to deal with. With that, we come to the close of our part one. That is part one of substance use, abuse, and dependence. Substance use, abuse, and dependence, where we have defined substance disorders, and we have also looked at the causes. We have defined substance use, substance abuse, and the substance disorders. We have also looked at the definition and the causes of substance disorders, and we've looked further into the causes of substance abuse, and gone on to look at the diagnosis of substance abuse and also treatment of substance abuse. That may not be the last thing that you learn about substance and drug abuse. We shall be going into part two, and then eventually into part three. That will suffice, that is enough for our course at this level. And as we proceed, we shall learn more about substance and drug abuse. God bless you. Let us meet next time. Remember what we said? The Bible told us, my people are gone into captivity because they lack knowledge. Isaiah chapter 5 verse 13 and verse 14 says that Sheol, because of that lack of knowledge, Sheol has opened, or hell has opened herself to swallow up, the very people that we live with, our families, our young people. We need knowledge. Knowledge is what will cover the mouth of Sheol from taking our children into captivity, taking our young people, taking our families and our communities into captivity. It is well. See you next time. Be ready for the next module, or for the next part of this great teaching. Shalom.